All right, so sacral neuromodulation is a relatively new procedure. So it involves two phases. One is the trial phase, and the other one is the actual implant phase. So the trial phase of this procedure involves placing two leads in the back, in the lower back. We just numb up the back and then put two leads, one on each side, that go that go through the spinal foramen, which are openings in the sacrum. Sacrum is the bone that supports your pelvis in the back, and the two foramen let these wires go through it, and then they end up near the nerves that supply the urine as well as stool controlling muscles. So, as you may know already, sacral neuromodulation is a procedure we do in patients with urinary incontinence, fecal incontinence, which means they're leaking out urine, they're leaking out stool without control, and which is not due to like other identifiable causes. So, when you do this trial procedure, after you put these leads in the back, you leave them in with an external transmitter, external generator, and you just tape it to the back, and you leave it in place, the whole setup, for almost 5 days. So during these 5 days, the only drawback is you cannot shower. You have to do a scrub bath so the thing in the back doesn't get wet. And then after 5 days, you come back to the office and we remove the leads in the back and put a little band-aid on top. And the process to insert the leads takes about half an hour to 45 minutes, and it's a pretty simple procedure. And it can be done at the surgery center. And then when you come back, we remove it, and there is a remote way of monitoring your response. So during that 5 days, when you have the leads in, this is a kind of external generator that's attached to the back, along with the leads that go in from here. And then you also get this keychain-like device during your trial period, which you can have, and this has some buttons. You can see this is the up button and the down button, so that will increase your current, decrease the current during that 5 days of trial period. And also, if you get the actual implant, you also get the same kind of device where you can increase the amount of current that is going to the nerves and holding those muscles tight, so that a person would not leak out urine or stool. So when you come back at the end of that 5 days, we remove the leads and put band-aids on top. And then there's a remote way that the company monitors all the things that you're doing with the device, like increasing, decreasing the current, etc. And then we get a report to see how good you responded. How much current you used, and also you prepare a report clinically to report like how many stools you've been having and how good you're feeling, etc. They'll give you a little thing to record all those symptoms. And then if there's a significant difference between the pre versus the post trial, pre and the during trial, pre versus post, post the lead placement, then at least a 50% response is considered necessary to move on to the next step. But usually patients, if selected properly, have a very good response rate, better than that. Then you go for the real implant, which is a small device that is implanted in the back under the buttock fat, so it doesn't appear outside. And this is the size of the actual device that gets implanted in the lower back or under the buttock fat. And then leads go from this directly into to the nerves internally that supply your bladder muscles as well as the muscles that control the expulsion of stool. And this is the external charger that can charge once the device is inside. You see the size of this thing. This is a device, so if it's implanted in the body, then you have it here, and this device goes on top and it charges it from outside. So this is after the permanent implant. So you can charge it from outside, and usually the battery life is up to 15 years. But if you require charging in between, you can also do it with this device from outside. The problem with the previous devices that were in this space was that they had to be removed after a few years to replenish the battery. They couldn't be externally charged, and so that was a problem, and you required multiple procedures to get the same results. So the advantage with this new system is that it would last up to 15 years, and there's no need to remove it, and once it's implanted, it's implanted. So, but remember, there's 2 phases to the trial, and it's phase 1 involves 5 days where we put the leads, simple procedure, outpatient procedure, and then come back at the end, get the leads removed, and we see the response in the urinary incontinence, fecal incontinence, and other symptoms. And then if you pass that phase, or you get a very good response during that phase, then you move on to the next step, which is a minor surgery. It takes about 45 minutes, and the things that I showed you, the implant is put under the buttock fat or the buttock muscles, or under the buttock muscles, and it stays for a long time to help control fecal and urinary incontinence.